friends, thank you for your time. I would like to request all of you to kindly wait for a few minutes as our author is going to join us very soon. We are actually facing some technical glitches. Give us some more time. We are going to start anytime right now. We have with us uh, Anjali Sani, Avinash Shukla, Dr. Manivanan Murugian, Harpreet Kaur, Kasturi D, Mir Ahmed, Saima Jan, Sebastian J. Peng, Sebastian J. Sham Salve, Vikrant Shah, Yash Malik, Zainab Fatima, and many more. We are live. We are now live, and we are expecting our author to join us very soon. So, dear friends and the participants of today's webinar, we as CBS Publishers and Distributors, as the educational publisher, we want you to kindly give support us for such webinars, because these are purely educational webinars, and we want all of you, especially the students to join these webinars, because we take the feedback from the students on which they want us to conduct the webinars. Secondly, the most important thing is that they join us. They should join us because we are on to provide them as much as facilitate them as much as possible during the session, during their exams, during the entire period of their curriculum. We want them to stay updated with the we want them to stay updated, and also help them to crack their exams properly, and they so that they can they can secure best in the exams. So I would like to thank all of you that you are here, and sorry for being a bit late. Now I'm thankful Dr. Reena Ruprai has joined us, the author, the speaker of day has joined us. So, ma'am, can we start with the webinar, ma'am? So let me start, dear friends, that today on 27th of April 24, good evening to our esteemed panelists, or dear students, faculties from medical, allied health science segments. I, Anu Raina, on behalf of CBS Publishers and Distributors, welcome all of you for the today's topic, that is skillful paper writing for better scoring in exams. Our speaker of the day is Dr. Reena Kaur Ruprai, being the speaker of the day, and I am thankful for her being, she has taken a voluntarily initiative to talk about this subject. And for this kind of activism, I really am thankful to Dr. Reena wholeheartedly, since everybody knows that first year students are going to have their exams. So for their preparation, we would like them to have the tips and tricks as a dose to success mantra. That is why we are collaborating with lots of the authors for these various sessions with our esteemed authors as well, and to facilitate everyone, right? So I would like to say a few lines about our the author of the speaker of the day, that is Dr. Reena. Presently, she is an associate professor from Government Medical College, Nagpur, and has more than 50 years of teaching experience. Her passion towards teaching has been so been recognized that she has also been the faculty for NEET PG, FMMG, MDS at Delhi Academy of Medical Education, and she has also been teaching with an academy. She has also completed advanced course in medical education. She has published lots of articles in the international and national journals. She has attended various CMEs and symposiums during her career, and she has also been the guest lecturer to various institutes. She has been awarded the Best Teachers Award from Government College, Medical College, Nagpur. I would now request, before we start with this session, I would now request Dalji to present the code of conduct to start with the scientific session with our author, Dr. Reena. It's over to Dalji.
Thank you so much, ma'am. Now I am presenting my code of conduct. So all the participants may kindly keep their speakers, mics on mute during the session. If anyone has any query during the session, kindly raise your hands or message in the chat box. The moderator will address your query. For question answer session, all the participants can put their questions in the chat box, which the moderator will take up later during the session. And special attraction is there for all the attendees. 3 winners will get free book who participates for the entire event, and free access to e-books at EduPort for 7 days, and e-certificates will be given to all the attendees. Thank you so much, and over to you, Anu ma'am.
Daljir, you may kindly give the permission to Dr. Reena so that she can start the presentation.
Okay.
Because she has joined directly through as a registration, but she was not able to join as a panelist. Right? So,
And ma'am will be here, right?
yeah, Dr. Reena. Dr. Reena, kindly, yes. Dr. Reena is here. Dr. Reena, kindly share your screen. Yeah, Dr. Reena is about to share the screen. Yes, ma'am, this is fine. You can see your screen. Ma'am, you have to keep your mic on. Your mic is off.
Yes. Am I audible?
Yes. You're audible now, ma'am.
And is the screen available? The
Yes.
PPT?
Screen is available, and I would request to say a few lines before you start with the presentation.
Yeah, sure. So I am really thankful to the CBS Publications, to Anu ma'am, like whatever, we had planned, ma'am had thought, yes, this would be a session. This is actually a very wonderful session and rather a very helpful session for all the students, I would like to tell you, because we study a lot, but then we don't know how to write. This is something very importantly and a very important concern from my side. So we just came up with this topic, and I'm thankful to Anu ma'am for this wonderful opportunity to me and to the entire students, so that the small things as an examiner, as an invigilator, I really experience, I can share with my students, so that henceforth they would be in a position to overcome these difficulties. Is it okay? Yes, everyone? So shall we start with the session?
Yes, ma'am. Yes. Go
Yes.
ahead.
So I'm starting, and I'm going to highlight you what are the do's and don'ts for the exams, right? हमको क्या करना चाहिए, हमको क्या नहीं करना चाहिए. And later on in this short span of 2 to 3 months, how should we move ahead, right? So the first thing which we will be looking upon into is how to write the exams effectively. Okay, how to write the exam effectively. So the very first important thing which I have noticed among the student is that the night, this is just prior to exam, you study overnight. I have seen that you take up your books and you try to mug up as much as possible. और आपको लगता है कि वो जो last minute का study है आपका, that is going to help you to conquer the entire question paper. So let me tell you that this is not at all a fact, right? So whenever you are doing this, like exam के एक दिन पहले you are sitting and you are studying, you don't have to do that. What is the main important thing is, जो भी आप पूरा रात में कोशिश करोगे कि आज रात में मैं पूरा पढ़ लूंगी या पढ़ लूंगा, you are never going to bring about retention. Just remember, if you have studied in physiology, one of the very important concept of physiology, the sleep is consolidation of memory, isn't it? So if you cram up the information just last night prior to exam, okay, so just prior to your exam you're trying to cram up all many information, it will never allow your retention. If you look into physiology, whenever we learn something, what does the brain do? The brain tries to distinguish between what is new and what is old, right? और जो भी new होगा उसी को हम रखते हैं brain में. But ऐसे क्या होता है जब आप रात भर पढ़ते हैं, you are just mugging up, you are confusing your brain. You are literally confusing your brain. So whatever you are trying to retain briefly will be retained, but it will fade away. Rather, you will always be getting confused to write in the paper if you always try to just mug up the last night. So I always tell you that studying is just not studying. It is actually understanding of the concept, right? So understanding can never be done ek din raat ko. It can never be done. It is going to give you lots of stress to cover the entire syllabus. And that stress is going to be non-productive. Moreover, you're going to suffer with your health, isn't it? There will be a feeling of low and you will not be focused. And all these will be reflected in writing your paper the next morning. So I tell you personally, right? I tell you personally, my own personal experience, second year में when I was giving my pathology 1 थोड़ा सा बिगड़ गया था because of this, you know. I tried to study it a lot because the pathology is very vast. But then I did not make a mistake for Patho 2. Patho 2 में मैंने क्या किया? I took a good sleep. So whatever I could remember, that I could write it better. So I really advise you that a long-term success is going to just by building up good habits and consistent study from now. So this is the time where you can study more, right? This is the time when you can study more. But never try to study for hours the exam before, the night before your exam. Take a very peaceful sleep. And just don't think that this is a very, just a tip कि कोई काम का नहीं है, पढ़ना पड़ता है, course complete नहीं होता है. Course complete हो जाएगा, but कुछ retain नहीं होगा. Right? So sona, that is taking adequate sleep, is very important. Don't try to mug up the last night. Second important thing is when you enter the exam, right? I have seen that many of the students, they enter the exam just 5 minutes before. They are having a hustle and bustle and late ho raha hai. I don't know how and why you are not able to manage your time. आप क्यों time manage नहीं कर पाते हो? That is something very important. You should be at a pace to manage your time. हम लोग तो मैं तो बोलूंगी कि at least half an hour prior to the exams you should be there. If not half an hour, then at least 15 minutes before your exam has to start, you should be in the examination hall so that you are able to enter peacefully. Because when you are entering the hall peacefully, you are much focused. You are not in the position of stress. You have to set up a very calm and a confident tone for this exam experience. And if you come and if you keep on discussing with your friends about the topics, that unnecessary conflicts are also to be avoided. Once you've left your home, all the books should be in your bag. Your mind should be very, very peaceful and calm. Just keep confidence that I have studied and I'm going to reproduce it in a better manner. These are very, very small tips, but they are very, very essential. And all these have come from examination experiences as a student and as a teacher. Never be late and enter your exam with a very focused attention. For that, you should always be on time, rather before time. I have seen even in the exams, I see when we take exams in the college, अगर 10 बजे का exam है, 10 बजे तक बच्चे आ रहे हैं, and one of the बच्चे is going to get a scolding. That scolding will again have an adverse effect upon your mood and mind. So वैसा बिल्कुल मत करो. Come before time, keep yourself focused and CC, that is calm and confident. Now, third important thing, as you come in, first the thing which you get is your answer papers. है ना? So once you get your answer papers, please fill all the necessary information, like your roll number or date or the topic or the heading, like physiology paper hai, anatomy hai, jo bhi hai, or if you want to put margins, signature. Signature is something which many of the students forget. और हमको लगता है हम बाद में कर लेंगे. But then बाद में we don't get time, and these are the things which will keep your result withheld. Simple small things can keep your result withheld. So once you get your answer paper, be very careful that you complete all the formalities and again maintain peace. Don't look here and there to your friends. Don't confuse yourself till you get your question paper. Now, as soon as we get the question paper, again, we are very, very much jumbled. You know, we are very much jumbled. We are scared. Don't be scared. First thing is when you get the question paper, always see that the question paper is complete. Many of the times in the departments when we conduct the exam, suppose question 4 was last and it was not printed. ऐसा हो सकता है. So always be sure that whatever question paper you are getting, it is complete, it is very clear. There is no problem in printing. You are able to read it properly. Once that is confirmed, then you look over to the question paper, right? और अभी तो कैसा है? You get MCQ. So when you have got the MCQ paper with you, only focus on that MCQ for 30 minutes. If you complete before 30 minutes, then only look over to your question paper. That is section B and section C. उसके पहले नहीं. So first हमको question paper मिलेगा, answer paper मिलेगा. We will write the formalities. Then we will be getting section A. Section A में क्या है? MCQs. Analyze, read it very, very carefully. MCQs are something which are made wrong even by mistake. जैसे all of them are true except. So what may happen? You may miss out that except. Okay, you may miss out that except. This has to be very carefully read. So once you get the MCQ, read it. I would prefer that once you are reading the MCQ, don't even look at the 4 options. Analyze it, interpret, understand it, get an answer into your brain, and then think or look over the options. Options are very confusing, right? 2 are always confounders. They will always confuse you. So आपके मन में आप एक आंसर बना लो कि this is the answer, this is my concept. Don't look here and there, 1 ka 2, 2 ka B. That is only going to waste your time. So solve the MCQs very, very carefully. There could be 1 or 2 MCQs you are having doubt. So जो doubt वाले MCQs है, you can keep it for the last, but not to rely upon anybody else's knowledge. वो मत करो. Nobody is more sharper than you. That is a misunderstanding. There is no negative marking in the MCQs of the pattern. So remember, जब negative marking नहीं है, तो हमको सारे MCQs को solve करना है. We have to solve all the 20 MCQs because there is no negative marking. So don't mistake say या deliberately leave any MCQ. Sometimes even if we do a small tukka and it comes correct, you can score +1. So don't leave any MCQs, don't leave anything for last. Last 5 minutes तक आपका सारा MCQ half an hour में हो जाना चाहिए, और हो जाता है because जो exam set करेगा, he or she will take into this consideration that you are able to do that in the 30-minute duration. Now comes your LAQ and your SAQs. सबसे पहले, I should say that when you are getting the question paper, read the questions very, very carefully. Very carefully. I have seen that if you don't read the question carefully, you land up into big mistakes. I give you an example. Nowadays, you are getting case histories, isn't it? A person with so-and-so complaint comes with so-and-so, and you are asked the physiology behind it as far as physiology is concerned. So we gave a question. It was a university pattern that a patient, 45-year-old, comes with polydipsia, and polyuria. And the urine specific gravity was given. So polydipsia, polyuria सुन लिया. And answer क्या लिख कर आ गए? पूरा diabetes mellitus. But polydipsia है, polyuria है, उसके अलावा कुछ भी और नहीं दिया है. Urine specific gravity is given low. Blood sugar was given normal. You could have thought about diabetes insipidus. Such small silly mistakes से आपको गड़बड़ होती है. Because you be very hasty. You be very overconfident. नहीं, मुझे आता है ये. Always read the question, but analyze it, interpret it very, very carefully. And you can imagine कि आपको ADH लिखना है और आप क्या लिख कर आ गए? Insulin, and you will get 0. Even if you've written the entire insulin correctly, you will get 0 because you did not read it, you did not analyze it correctly. So don't make such big mistakes. You understand 4-5 marks SAQ or an 8 marks LAQ, it can really drop your level. So उसको कभी भी नहीं करना, आपको question को बहुत अच्छे से read करना है. You should know what to write. So what I say that when you are preparing for your, just before your exam, suppose it is the second or the third revision, look into the question papers, how the question is asked. Definition is asked, write definition. Right? If you are asked, mention the factors. Suppose I ask you, what are the factors affecting blood pressure? Or I ask you, what are the determinants of blood pressure? See, both of them are different. अगर मैं आपसे पूछ रही हूँ, what are the factors affecting blood pressure? It will be age, sex, body weight, okay, diurnal variation, effect of sleep, effect of diet, sex, pregnancy. But if I ask you determinants of your blood pressure, then the determinants become your cardiac output and total peripheral resistance, because blood pressure is equal to cardiac output into total peripheral resistance. So this is very important that when you are learning, but when you are writing, what mistakes you commit. Similarly, GFR. GFR, that is the glomerular filtration rate, is a question which is very repeatedly asked. क्या पूछते हैं, क्या लिखते हैं, you just don't understand. So definition पूछी है, factors affecting पूछा है, regulation पूछा है. You have to be that specific, and for that specificity, the last revision of your physiology or anatomy or biochemistry should always be with the last at least 5 years question papers. आप देखो वो 5 years question papers और आप समझो questions को put up कैसे करते हैं. Right? Now, when you are writing, okay, when you are writing, I really give you a wonderful advice that please don't write big, big history, geography, like big, big paragraphs. These are the things which the commerce or the arts people might be doing. So we are all medicos and we are in the medical profession. We don't want quantity. We want quality of papers. We want quality, right? That means suppose if there is an answer and I can simplify with the help of a flow chart or with the help of a diagram, better do that, right? They say NMJ, events taking place at the neuromuscular junction. You can analyze this in 2 to 3 pages, but I just analyze in 10 points. Action potential coming to the terminal, release of the neurotransmitter, binding of neurotransmitter to its receptor on the postsynaptic membrane, release of acetylcholine, opening of the ligand-gated sodium channels, depolarization, and then how excitation. So 10 sentences may I have completed my answer. Rather, to enhance your answer, wherever you have put a line of clinical applied physiology, even if it is not asked, myasthenia gravis. इतना सा भी आपने लिख दिया, it will highlight your answer. It will really look that you have the concept. You are able to take your basic sciences and apply it to your clinics. So flow charts are the best part, where a very complex information can be given in a beautiful illustrative manner. You organize the information, and so visually that information looks very wonderful, very, very wonderful if you are making flow charts. Then pathways. Up CNS mein, you have abundance of pathways. So I have seen that students, they draw diagrams, students, they write. Don't do that. If possible, just draw the diagram, and with drawing of the diagram, you can show your pathway. So if anytime, if we meet or we connect, I will show you how to write answers, especially CNS ke jo tracks hai. Now there is medulla, there is spinal cord, there is pons. Please don't draw it like we draw in anatomy. Don't draw it, right? Even thalamus, then cortex. If you keep on drawing and showing your drawing skill, you may miss out. You have to make it in a form like even small circles or boxes, and then writing it correctly, like from the spinal cord going to the medulla. So I make a small circle for medulla. Then I write over there whether it is crossing or whether it is not crossing, like the ascending pathway, jo hamara sensory hai, that is our dorsal column. They will cross after medulla. So you can write after medulla. But हमारा जो pain pathway है, anterolateral system, it will cross at the level of spinal cord. So वहां पे मुझे डालना पड़ेगा कि there is crossing, है ना? So you will have to represent yourself. This is going to save your time. So if you, as far as possible, diagrams and flowcharts, like neuromuscular junction. If you draw it beautifully and if you label it beautifully, or वही vesicle के बाजू आपने लिख दिया acetylcholine, there is no need of writing it completely. It is well understood that you've drawn it, and because you've drawn, that means you know it nicely. This is going to save your time also. And as an examiner, like if I am supposed to check your paper, it becomes so easy for me that I may give you really a half mark extra for the clarity of the representation which you have done. Okay, so just recollect, what did we say? The last night we are going to be very, very calm. We're going to take a good sleep. We're going to enter the hall very peacefully. Take the answer paper, write the important things, the name and everything which is required. I'm going to analyze the question paper. I'm going to, as much as possible, illustrate my answers with the help of diagrams and flowcharts. Now, don't leave any question unanswered. Just imagine, even if you know and you have missed out, ठीक है? अगर कोई 4 मार्क का क्वेश्चन छूट जाता है, 2 मार्क का क्वेश्चन छूट जाता है, that is going to be a big zero. If you write something, you may get a half, क्योंकि कहीं तो कुछ कनेक्शन आएगा. बट अगर आपने कुछ लिखा ही नहीं है, तो जीरो मिलेगा, है ना? So इसको कैसे अवॉइड कर सकते हैं आप? Either on the question paper, you can tick mark with pencil. This is done, this is done, this is done. This is the same way I have taught my own children who are still school going, that you know that you can miss the answer. So हमको क्या करना है? जैसे ही हमने question complete कर दिया, हमको tick कर देना है that these many questions I have completed, right? Then if you are writing the question, suppose question 2 सब complete हो गया, उसका E या G बच गया और उसको हम last में लिख रहे हैं, जो normally बच्चे करते हैं. Again, it becomes very, very difficult for the examiner, for the invigilator to find out ये कौन सा question था. It adds up irritation. You know, there are so many bundles of papers to be checked that checking is a very tedious job for an examiner. So simplify his or her life by labeling it properly. Suppose you have completed, if you get BAQ at our university, MUHS, we get 10 BAQs to be solved, right? So 8, 7, 8 अगर हमने first page पर कर दिया है, 2 बच गए हैं और हम last page पर उसको लेके जा रहे हैं. So for that last page ना, write it. What question it was, question 2, question 3, A, B, C, कौन सा question था, उसको लिख दो कि ये this was the question about Brown-Sequard syndrome. This was the question. This will really, make it easier for the examiner, and it will make it easy for you also that you have attempted. So as far as possible, write it very, very correctly. The numbering of the question has to be done very, very correctly. This will avoid skipping or leaving of the answers. Now, how should you write? This is very important. Sometimes we feel that if we write anything, and if our writing is not very much visible, the examiner may just look into the bulb that अरे इसने 3-4 pages लिख लिया है, and you will get marks. It is not like that. Your writing should be readable, right? It should be readable. Wherever necessary, bold करो. अगर आप topic लिख रहे हो या topic में, like while writing an answer, there is something which is important. Suppose I write a name of a disease, I write a name of a receptor. Inverted डाल दो या उसको bold कर दो या उसको capital लिखो. If there is anything specific in your answer, bold it. You use either blue pen or black pen. So wherever important things are there, you can just underline those important things. Because once I get that this you have covered, right? I then feel कि हाँ इसको ये answer आता है. Make a habit of introducing an answer when you write an LAQ. Then what are the points? So many points are there. This is the subtype, and then you start elaborating it. अगर आपका introduction अच्छा है और अगर आपने कैसे लिखा वो अच्छा है, that is very, very appealing to the examiner. Then managing your speed is very important. I have seen that if you are knowing a particular answer, even if it is of 2 marks, you keep on writing pages over it. Just remember, if it is a 2 marks answer, maximum points 4 is needed. 4 points से ज़्यादा आपको लिखने की ज़रूरत नहीं है. And maximum marks मैं जितने दे सकती हूँ is only 2. So even for that 2 marks paper, if you are writing 10 pages, I will give you only 2. So you have to quantify कितने number का answer है, and उसके accordingly you will have to write. So as I've told you that quantity doesn't matter in our profession. We are not at all greedy for the number of pages you are writing. We are more concerned with what you are writing. ठीक है? So जितने mark का question है, अभी BAQs में तो it is very specific. Name the 4 tracts. Name the 4 neurotransmitters. So write only that much. Right? Now, when you are writing your SAQs, some universities have 5 mark ka SAQ, some have got 7 mark ka. How much time to be given? If it is an LAQ 10 marks, how much time is to be given? Time management is one of the art of scoring very, very good marks with your paper. It has been seen that there are many good students, but they are not able to have a time management. So when you are not able to have a time management, even if you are knowing, you are not able to write. And that is the condition, you feel very, very bad. कि मेरे को आता था, but मैं complete नहीं कर पाई. So many students, they prefer writing LAQs at the start. It is very good to write the LAQs at the start, but remember, even if you know lots about it, you have to concise. Because if you keep on devoting about 1.5 hours only to your LAQs, your remaining answers will suffer. So it is your choice whether you start with BAQ, with SAQ, or with LAQ. Whatever you write, please manage your time so that every answer is justified. And then only, your score, which can be 60, can be shifted up to 70. This is, everybody can pass as far as the examination pattern is there. Everybody can pass. But if you want that extra edge in your content, or you want that extra edge in your scores, these are the very small, small things which will take you up. So don't think that if you really keep on writing speed and kuch bhi likh denge, teacher will give you marks because the volume is big. We don't give marks like this unless until we are able to read and understand. If you think that your writing is not well good, please draw diagrams or please make flowcharts. Don't write stories because you keep on repeating the same thing in that one paragraph. So don't do that. Be very clear, be very specific. Justify to the marks allotted to that particular question. Underline wherever it is needed, wherever it is important, or bold it. As I told you, we've already covered that you have to read the questions very carefully and you have to interpret the question before you write. We are sometimes so enthusiastic that the moment we get the question paper, we start writing. We just start writing. Always prepare an answer into your mind. Okay? Suppose a question comes on cardiac cycle, an LAQ on cardiac cycle. So what am I going to write? It is a 10 marks question. मुझे क्या-क्या लिखना है? I should write the definition, duration, I should mention the events, and then every event has to be described. So writing the event should come up. It has got atrial systole, ventricular systole, and the subcomponents. Itna apne cover kar liya, and then you elaborate depending upon the time. If you have got less time, again, draw the cardiac cycle diagram and keep on writing about the phases over there. But don't write many, many, many pages because you love that answer. There are certain questions which are very favorable. They are very, very favorite because we learn them so much times. And agar wo aa jata hai, to we keep on writing. So don't do that. Similarly, endocrines. Endocrines I have seen that koi bhi question aa jaye. Hyperglycemia, hyperlipidemia is in everything. So try to learn in a manner that you are able to remember. You are able to remember the odd ones, like all are hyperglycemic hormones except insulin. Which hormones which have specific effect on fat or glucose or proteins. ऐसे आपको याद रखना है. Try to remember the differences rather than remembering the similarities. Right? And again, endocrines पर अगर question आता है, so it is a clinical based question. So be prepared for that clinical based question. Don't misinterpret. नहीं तो जैसे मैंने बताया आपको, diabetes mellitus and diabetes insipidus. Common mistake. Like second common mistake, Cushing syndrome and mixed edema. Very commonly. Cushing syndrome में भी obesity है, mixed edema में भी obesity है. आप वही point याद रखते हो. But remember the other important features. Pigmentation, BMR. Remember like that. Okay? Now, as I told you, time management. It is very, very important to have a safe time zone at the end. It is not possible that you may end up your paper half an hour before. At least 10 minutes safe should be in your hand so that you are able to recheck the paper, that all the points have been completed. You have solved each and every question. You have signed it. The invigilator in the examination hall has signed it. If you have taken a supplement, it is signed. Everything is completed. If you have that safe zone, you feel more satisfied. And I have seen that there are many students who are writing in such a perfect manner that unke paas end mein time bachta hai, so that they can go through, and if any gross mistake is made, they can just take up that mistake, right? So time management is a key to your best writing of papers. Finally, this is the commonest thing which is seen. So time management जो हम करते हैं, हम last time के लिए रख लेते हैं, हम इधर उधर देख लें. Isn't it? We usually believe यार उसको ज्यादा आता होगा मेरे से. So हम इसका देख रहे हैं, उसका देख रहे हैं, उससे पूछ रहे हैं. Nobody is intelligent as you are. Rely on your own knowledge. Sometimes किसी दूसरे बच्चे का सुनकर आप आपका correct answer को wrong कर देंगे. ये भी होता है. So accept that whatever you learn, whatever you know is correct. Bas. And then whatever happens was your destiny. Don't cancel your answers, rewrite your answers. Usne aisa kiya, isne aisa kiya. This is, obviously it is not ethical to cheat in the exam. It is not ethical, definitely. Apart from this ethical wala portion, if you develop this habit, you will never have a critical thinking skill. Every examiner is going to put certain questions which is not read by the student. Even we have passed through it. Entire question I don't know. But that is the time where I have to apply my 1 year knowledge. So for this, this is going to actually help you to foster your skills. You are into a health profession. Every time you are not going to get same patients. ऐसे होगा क्या? अगर आप physician है, एक ही patient आएंगे आपके पास नहीं. You may get a very new patient, and at that time what you will do? Will you call somebody to help you? No. So think about that. You are not a regular BA BCom student. You are a health professional. You need to have that critical thinking. So even if you are coming across a question which you have not read, try to solve it on your own. Try to solve it. Don't think that the other person is going to know better and then you will keep on writing anything. This is going to hinder your personal development and your learning experience. And this will become your habit, not only in writing, but throughout your life. That if you are not knowing anything, you will always take help. You are not supposed to take help now. You are supposed to have your own critical thinking. Remember, these are very small things. But remember, we are health professionals. We have to learn this, that if there is a new situation into our life, how are we going to develop a skill in that new situation? So हमेशा जब पेपर आता है तो सिर्फ पास होने के बारे नहीं सोचना है कि हमको पास होना है. पास तो आप हो ही जाओगे, बट हम क्या डेवलप करेंगे इज मोर इम्पोर्टेंट. Now, avoid post examination discussion. आज अनाट 1 हो गया, अनाट 2 हो गया, कल फिजियो है. No need to discuss about the thing which has happened. Even if it is wrong, nothing is going to change. You cannot go back into the examination hall to correct it. You cannot do that. This, when you bring about this discussions, you compromise the fairness of your future exam. You waste your time. You feel low because you evaluate your performance with your peers. And वो peer का भी गलत होगा, आपको क्या पता? Student A is saying I am correct, student B को बोल रहा है. अब student A को क्या पता, उसने ही गलत लिखा होगा, student B सही होगा. So once the paper is done, avoid this post exam discussion, avoid confusion, avoid transmitting this misinformation, opening the books to look whether you've written correct or not. No need. Once it is done, it is done. Just close it now. Next day देखा जाएगा. Next exam will be better than this. So avoid this post examination discussion with your friends. Be ready with the preparation for the next exam. So read the instructions, read the questions carefully, interpret, check the marks on each question, plan out the time, plan out the answer before writing, do a very correct numbering of the question papers, wherever necessary, wherever you can, enhance your answers with diagrams, with flowcharts, and always keep a safe time at the end of the exam. I don't know whether you believe in the magic of prayers and blessings, but I believe a lot. So God is not going to come and answer your question. He's never going to come and write for you. But if we do a small prayer for ourselves, we will develop that confidence, that guidance. It is just a way to channelize your positive energy and confidence when we are in such high pressure zones. Exam is a high pressure zone. Exam is a stress, and it will elevate all your stress hormones. So that stress can be calmed down by your blessings of your mother, father, your siblings, your best wishes, your pray to God, a small pray to God. Even before you come to the exam, you take bath and you do a small prayer. You just look into the question paper. Before that, you thank God to give you the courage to solve the question paper. And I believe that these are very small things, but these are, the ways that we practice positivity and optimism towards exam. Exam is a stress. It is a physiological stress, not a pathological stress. Everybody has to face exam. And believe me, ये जो हमारे एग्जाम होते हैं जिसमें हमको सिर्फ पास होना है, these are the easiest stresses of your life. These are the easiest challenges of your life. Just prepare yourself for the bigger challenges you have to do, right? So for now, I wind up the session. I don't wind up the session. I give you my best wishes. If there is any question, we can open up. And अभी जो मैं आपको बोलना चाहूंगी, before this is the exam protocol which you are going to follow before the exam. अभी आपको क्या करना है? You have got safe 2 months with you. Safe 2 months. For university को तो ज्यादा भी होगा. Remember, you have to set goals for yourself. Make goals for a week, for a month. Manage your time, right? Avoid social media. This is very distracting. One of the way which I also use is like whenever I am studying, I'm going to switch off my mobile data. Whatever messages they come, they are in the phone, but I'm not going to check them, right? Because if you keep on checking them repeatedly, you distract your mind. You disconnect your synaptic circuits in the brain. You keep on disconnecting your circuits when you shift from one point to another point. Another important thing which I practice and which I give you as an advice, our exam is for 3 hours. So you take a question paper once you've completed your studying. Suppose I take physiology. I sit for that 3 hours together, right? पढ़ते समय भी I make a habit that I'm studying 3 hours together. I'm not going to go out except for nature's call. Water, coffee is all with me. When I sit for 3 hours together, I build up that concentration for 3 hours. Because आप एक साथ 3 घंटे बैठते नहीं हो. Exam के समय it is very difficult. You know, even in the lectures you talk, right? So sitting together for 3 hours is a big deal. So जब आप पढ़ने लग रहे हो, make a habit कि जब मैं पढ़ रही हूँ, 3 hours I'm not going to move here and there. I'm going to study except nature's call. Final revision, take a question paper, last year's question paper or your department का last year का question paper, solve that question paper, make a practice that you solve at least one question paper for each subject and कहाँ पर आपको कितना देर लग रही है, you can analyze so that the time management will be perfect. So these are the simple tips which I have given from my side. If you have anything more to share with me, you can do that. So it's over to you, Anu ma'am, for anything else to be added. Thank you from my side and best wishes.
Yeah, there is a question, I suppose. Can I use color pens while writing answers during exams?
No, ma'am. I think color pens are nowadays not much allowed. It's only the black and the blue pen which we are using. And
So-
HNE pencils can be used. HNE pencils.
Right. Can you elaborate on what is the examiner's mindset like while evaluating answer sheets, which differentiates average scorers from high scorers?
Definitely, Kasturi, that's what I told you. Suppose there is a bacha who is writing ascending tract और उसने बिल्कुल ascending tract को एक paragraph बनाकर लिख दिया, ठीक है? लेकिन दूसरा बच्चा, he has written the ascending tract in the form of a diagram or in the form of a flow chart. The more easier is your presentation, the visual impact of your presentation, it creates a wonderful impact which will give you 7 से एकदम 9 because you presented it very well. So whatever the question is asked to you, suppose I give you an example, define synapse, enumerate the synaptic properties in detail. How will be my answer? I'm going to define my synapse. I'm going to draw a diagram. This is synapse. And I'm going to first write out the 7 to 8 properties. Whatever the properties are, like whether it is fatigable, there is one-way conduction, there is summation, all these properties, just mention the properties and then elaborate it. So कभी कैसे होता है, आपने definition लिखी, आपने diagram draw किया, आपने सारे properties enumerate कर दिए, and before even I look into the depth of what you have written, I feel, no, she has written wonderfully, I'm going to give you a high score. So writing in big paragraphs is not good. Writing very specifically in the form of flowcharts, diagrams, whatever point is necessary, please underline it or write it bold. This is what, we expect as an examiner from students to write. Presentation skill.
Ma'am, first of all, can you kindly screen sharing को आप close कर दीजिए?
हाँ.
Yeah. So somebody has Riddhi Mondal. She's actually our student ambassador, ma'am. She has said that it was a wonderful session, and I have a question. You said that we should do the LAQ.
LAQ.
First, how should we highlight points in the LAQs to get higher scores?
Okay, so it is your choice, Riddhi, whether you want to write the LAQs पहले या बाद में. कभी कभी कैसे होता है, LAQs ऐसे आते हैं कि we are very thorough with the LAQs and we are confident, so go for it, right? But as I told you, 2.5 hours is left with you. Half hour is completed with MCQs. Don't devote 2 hours to LAQs. जैसे let us take an example. Suppose I give you a full question. Enumerate what is a tract, enumerate the different descending tracts, and write in detail about pyramidal tract. Suppose this is an LAQ. Okay, this is an LAQ. So first thing which I'm going to do is define the tract. Second point, there are two types of tract: ascending tract, descending tract. Third point, descending tracts. These are classified as pyramidal, extrapyramidal, and just write them. Pyramidal में कौन से आपके corticospinal tracts, and extrapyramidal, rubrospinal, and so on. Now the question is on describe the pyramidal tract. So pyramidal tract को लिखने से better है, I'm going to draw that pyramidal tract and I'm going to वहीं पर label it, how it starts from the cortex, crossing, and this and going down. I think one of the session, ma'am, we will do on how to write a paper. So I would like to show them कि हम paper को कैसे लिख सकते हैं for better marks. We'll try to have a session over that.
Yeah, there is another question from Mir Amir. How to increase writing speed, as there is a psychological pressure that we have to complete within the limited time.
Actually, Mir Amir, I would like to say that this is just a psychological pressure कि paper बहुत लंबा आता है और हमसे complete नहीं होगा. This is just, being put into your mind. It is never like that. Whoever is going to set the paper takes into mind that paper ऐसा होना चाहिए कि सारा paper time पर complete होगा. फिर भी आपको लगता है कि paper is too lengthy. Write the things which can be, written in very, very detail. Brief in it. थोड़ा brief करके लिखो so that all the questions are completed. All the questions are completed. Now, second important thing, how to remove that stress. Take a question paper and write it on your own. I practiced it till I completed my MD. I used to take one question paper, last year's question paper, and I used to sit 3 hours together, 9 से 12 या whatever time. और मैं देखती थी कि वो 3 घंटे में मेरे से कैसे कंप्लीट होगा. और फिर आपको टाइम मैनेजमेंट आ जाता है कि मेरा स्पीड थोड़ा सा और बढ़ाना है मेरे को, या ये स्पीड भी चल रही है. So the best way is practicing, practicing, and practicing. At least one paper, sitting 3 hours together during study time. आप 3 घंटे एक साथ पढ़ने बैठो, मोबाइल मत देखो, concentration बढ़ेगा. और 3 घंटे आप एक क्वेश्चन पेपर सॉल्व करो, आपका स्पीड बढ़ेगा. आपको पता चल जाएगा कि यार ये पॉइंट है जो मेरे को I can write better or I can improve.
There is another question from Abia. Because we were read both anatomy and physiology at the time of exam, is there any issue if we write some points of anatomy and physiology exam?
Right.
Because of that time, it is difficult to make difference in both subjects.
Yeah, it's a very good question and a very commonly done mistake. Like what I've seen is, like, there are certain things which are common in anatomy, common in physiology. For example, tract. Now, suppose I have learned the descending tract from physiology, right? Or I have learned it from anatomy. आपने जहां से भी learn किया है tract, उसको वहीं से learn करो. So tract अगर आपने learn कर दिया anatomy से, सिर्फ functions आप देखो physiology से, right? Thyroid में भी ऐसे ही होता है. थायराइड में एनाटॉमी आप फिजियोलॉजी से पढ़ ली तो वही, सॉरी, एनाटॉमी अगर आपने पढ़ी है एनाट से, डोंट रीड इट फ्रॉम फिजियोलॉजी. Functions from physiology, but when you go for the thyroid function test, don't read from physiology. Thyroid function tests are beautifully given in biochemistry. Don't read the same thing from 3 books. You don't have that much time. I have really, analyzed that the time management is difficult for you people. So any topic, if you have learned best from either anat, physio, or biochem, don't repeat it. As far as the biochemical tests are concerned, KFT, LFT, या फिर माल अब्जॉर्प्शन टेस्ट है या डाइजेशन अब्जॉर्प्शन है, वो आप बायोकेमिस्ट्री से पढ़ो. जो भी फंक्शनल पार्ट होता है वो फिजियोलॉजी से, एंड स्ट्रक्चरल पार्ट एनाटॉमी से. बट डबल डबल बुक से नहीं पढ़ना एक ही चीज, उससे टाइम वेस्ट होगा.
There's a question from Sayed Namat. Are gel pens permissible for writing answers?
दे आर परमिसिबल, बट एक ध्यान रखना कि वो कभी कभी पीछे, आई थिंक दे कीप अ मार्क, पीछे आपका पेपर पे मार्क ना हो. आई डोंट नो, बट जेल पेन्स आर परमिसिबल. देयर इज नो प्रॉब्लम विद द टाइप ऑफ द पेन, ओनली द कलर इज ब्लैक एंड ब्लू.
So, ma'am, this is our question answer session. All the questions have been answered by you. There is a person from Rashid Ali. Thank you, ma'am. We just need to look for examiners' mindset, because in some colleges, some faculties, just a second,
Are
some
not
faculty
satisfied.
are not even satisfied with all the answers we write. They want more.
No, then Rashid, what do they want more? That should be asked. This is the right of a student to justify कि क्यों और क्या लिखना चाहिए. Like what I do for my students, you know, whenever I set up the question paper, I always keep an answer paper in mind, a standard answer paper. So अगर आपको मार्क्स कम मिलते हैं कोई टीचर से, ठीक है, आप टीचर को बोलो कि मार्क्स कम है, नो इशू, बट देन टेल मी व्हाट शुड आई राइट मोर. द टीचर शुड जस्टिफाई दिस. बिल्कुल जस्टिफाई करना चाहिए.
There's a Priya Yadav who is saying that thanks a lot, ma'am, for this amazing session. It was really helpful, but I want to ask how to be stress-free during exams. Most of time, even though we know the answers, we can't express or write the way we want. That pressure somewhere prevent us to show our knowledge at that point.
वही तो मैंने बोला प्रिया. This is therefore we have taken this session, that you know a well, right, but you're not able to express it. And I tell you, Priya, that the first MBBS ka exam dena is one of the minutest stress of life. Being a medico, there are very huge challenges which we are going to face. Even the vivas become very difficult. There is nothing such as stress. A small amount of stress is always needed. अगर बिल्कुल भी स्ट्रेस नहीं होगा तो बच्चे पढ़ेंगे ही नहीं. जैसे हम बोलते हैं ना, ब्लड फ्लो को थोड़ा सा रेजिस्टेंस चाहिए. व्हाट इज आवर ब्लड फ्लो? Q is equal to delta P upon R. तो थोड़ा सा रेजिस्टेंस चाहिए हमको ब्लड फ्लो के लिए. लेकिन अगर आपने स्ट्रेस बढ़ा दिया, and if you keep on increasing that stress, it is definitely going to hamper your knowledge. You don't have to be stressed. You are an MBBS. You will pass. आपको डॉक्टर बनना ही है. It could be a few months here and there, but you will become MBBS passed. ये तो बहुत छोटा सा स्ट्रेस है. स्ट्रेस को लेना सीखो. टाइम टेबल बनाओ, टाइम टेबल को फॉलो करो. दिस इज द बेस्ट वे. मेक अ टाइम टेबल. Just make a timetable. Make your goals. Plot a graph. Graph can sometimes come into a plateau. It goes up, but never make it go down. That is the best way. Keep on, keeping yourself stress free. One of the thing is always have a small 10 to 15 minutes relaxing session for yourself. If you are at home, you have got mummy, papa, friends, siblings to talk. If you are at college, again, you have got somebody to talk. A small walk. I to even prefer a small dance, a small music. Even that is going to relieve your stress. You have to do that.
Okay. Rashid Ali has said, thank you, ma'am. There is another aspirant. Thank you, ma'am, for this helpful session. Viramir is saying that how should we approach an answer of question during Viva examinations?
Viva is vast like anything. I can ask you anything and everything. What is Viva? Theoretical, आपने जितनी theory पढ़ी है, right? So अगर आपको Viva का question पूछा है, pause, think and answer. अगर आपको answer नहीं आ रहा, you can say the examiner, please, I'm not able to answer this, change the question. But every question will not be changed. But if you take a stress during your Viva, you will never recollect what you have. So just avoid that taking stress. Exam is a normal, it's a part of life. We have to give different exams. तो स्ट्रेस से भी आपका एग्जाम भूल जाता है. एक्सपेरिमेंट्स में जैसे हिमैट में जो वाइवा क्वेश्चन होते हैं, सपोज हीमोग्लोबिन का प्रैक्टिकल है, you should know about the theory of hemoglobin and about Sahali's Sahali's का जो इंस्ट्रूमेंट है, that comparator. You have to know the principle of that, then the name of the solutions, the content of the solutions. These are the likely questions. But जो भी आप theory पढ़ते हैं वही वाइवा होता है.
So I think we have like completed our question answer session. Few of the messages that Zain and Fatima, very informative session, ma'am. Thank you
Thank
very
you.
much. Had a query that what strategy to adopt to cover syllabus for final exams in 2 months. Uh,
Okay.
I think
Uh,
you have covered that answer.
I've covered it. You have to be
Yes.
very planned now for the next 2 months. You have to be very planned.
Yeah. There is a saying, there is a question from actually Hari Godel is one of our student ambassador who helps us to like uh, penetrate these webinars within the students. Thank you, Hari, for being here. They're saying that not to leave a single question unattempted. There is a main problem as students need to recall something they have forgotten.
They need to recall something.
Something they have forgotten.
See, it is very, very, as a student, if I look into myself, there would be some things which I would have not even recollected. But मुझे ऐसे लगता है कि question is asked from a particular system. वो system तो आपको पता ही है ना, so write something about that system. Something about that system. Rather than leaving it blank, कुछ तो लिख कर आओ. Blank मत छोड़ो कोई भी आंसर और डेफिनेटली आपको हमेशा सारे आंसर्स नहीं आएंगे. It is not possible that every answer will be known to you. Even it won't be known to me as such after going through physiology for so many years.
Okay. मैम ये वाला जो जवाब है आपका कि यू वोंट बी एबल टू आंसर एवरी क्वेश्चन इवन इफ यू बीइंग MD in physiology today,
Yeah,
like you will not be in a position to answer. This is
exactly.
something a very relieving answer from all the participants over here.
Yeah, it is. If
Right.
एकदम से you ask me something about a depth, I may not able to recollect. I know the concept, but may I not be able. I may take time from you. Let me go through it. It happens in the class also. So it is very common. We are human beings for that.
Thank you, ma'am, for this wonderful session.
Thank
Ma'am,
you.
how do you want this entire session to summarize for the students? Any
Yeah,
tips?
yeah,
Again, very
definitely.
few tips.
Few tips is like, this last 2 months have to be very, very planned. Especially you're going to get your May vacations to study. So either you divide 2 days anatomy, 2 days physiology, or 2 days biochemistry, make a very apt timetable for you. Make goals which will be achievable, right? If you consider a particular system, I'm going to complete this system in 2 days. It should be 2.5 days, but not more than that. These last 2 months are very, very dedicated months. These three are the basic science, and every year you will come across. As far as physiology is concerned, जब आप medicine पढ़ेंगे, patho पढ़ेंगे, आपको फिर से physiology पढ़ना पड़ेगा. Don't rectify. Understand. Anatomy को पढ़ने के लिए diagrams. जैसे मैंने बोला, best होता है 3 घंटे के लिए keep your mobile aside and concentrate, focus for that 3 hours. Right? Make timetable for yourself. You have to make a timetable, and whatever we considered, that these are the things that I have to be prepared when I'm going to go for exam. And most important thing is don't take stress at all. Because nowadays the stress coping ability of the student is reducing, their tolerance is decreasing. I have seen. बहुत ऊंचा ऊंचा जाना नहीं है, हमको अच्छे से पास होना है बस. Don't take stress. Take 15 minutes relaxing for every day, at least 15 minutes for yourself, whatever you feel like. And please don't compare your studies with the study of your peer, and avoid social media for the next 2.5 months. All the social media.
I think that this is one of the important like thing, the tip you have given to aspirants. Yeah, social media is a big distraction nowadays.
Big distraction.
Everyone.
Yes, we need not respond every message. We need not put ourselves on Facebook and Insta. Let people follow you. You don't follow anybody.
Yeah, exactly.
Something.
Exactly. Exactly.
Yeah.
Exactly.
Okay.
Thank you, ma'am. I want to like from today's session, what I could get from your inputs is that we can also do a thing that is a suggestion. I don't know whether I'm right or wrong. Like if you have anatomy and physiology subjects which are reconnected to each other, certain topics, if they are reconnected to each other, what they can do is they can like read that topics in exhaustive manner in the both sections from the anatomy and physiology, so that they have an overview, holistic overview of that particular topic, I suggest, so that they don't need to repeat it again. So this way also they can reduce the time, like they don't have to read it again for the physiology.
Exactly, especially neurology.
Topics are common somewhere.
Certain topics are common. Definitely common.
Right. So connecting the topics would be better. I think
Better.
that makes the retaining much better, because
Actually.
I was also a student. That is one thing I used to do, reconnecting with the basics.
Connecting.
And secondly, I think you people need to be cool. What ma'am has told you, like cool and calm while preparing for exams. Thirdly is that, ma'am, which I also think, if we pressurize ourselves, the physiology of our body is like that,
Sure.
it will go into fear.
Exactly.
So that we also have to avoid.
That is very important thing. सबसे छोटा stress है exam.
Exactly.
बाद में we realize this.
Right. So wonderful session, ma'am. Everybody is happy. If I am thankful that even if the participants are less, but the students who have come over here, I am sure they will go back to their study tables with the hope that you can do anything. Such are the beautiful inputs, wonderful inputs which ma'am has given to you people. And yes, ma'am, you have given one more suggestion, that for any next session, students, you need to tell us when do you want that session. We will have a very limited session wherein ma'am will actually let you know how exactly you have to write a question. Right, where you should use more tables, like figures or charts, or where you need to have the text formats only. So ma'am, I think that is very important session, so that they can have an overview that what exactly they can put their write their answers and get the good scores.
Yeah.
Even if that, I think they should be out of this thing ki mindset kiska kaisa hai kaisa nahi hai. They should focus on whatever they are writing, that is right. That's very important.
Abhay, yes, we'll have that session. We'll connect with ma'am, Anu ma'am, and we'll keep that session. I'll prepare the answers, 1 or 2 LAQs and SEQs, and play you. ऐसे लिखना चाहिए
I think that's very important.
That we'll do. That we'll do.
Okay, ma'am. Thank you so much. Thank you, everyone over here. Thank you, the participants. I wish you all the best from CBS and the ma'am. And Dr. Sangeeta Jain, thank you for your good wishes. And I wish all of you the best. We will be sending you the feedback form so that you can send us your experience for the today's session. Secondly, I want you people to let us know, do you really want us to go for any next session for you, the exam going students? We will do that. Kindly let us know. And if you have any further questions for the speaker of the day today, you can write me wherein I have shared my email ID, so that you can get connected to the author directly. So once again, thank you for your time, for sparing time, but I'm sure you have got a wonderful knowledge from the ma'am. And all the best for your future endeavors. Thank you, ma'am. Thank you for your time.
So much,
I thank you all my co-colleagues, Daljit, and the marketing team to penetrate this wisdom across. Thank you, everyone. Thank you to CBS, my bosses who have given me who had shown their faith in me to conduct such sessions. And I assure you that the CBS, being the partner for education, will there be for you forever. Thank you, ma'am. Thank you, everyone.
Thank you so much.
And have a great weekend. Thank you, everyone.
Thank you, everyone. Bye-bye.
Thank you, ma'am.
Thank you, ma'am.